Hello students, I'm so happy to see you. Welcome to this lecture. Protocol schedule and screening. So what exactly is a schedule? So as you know, protocol means a series of visits and the assessments or procedures done in each of those visits. So schedule gives the timeline that we should carry out the visit based on, right? Exactly what timeline, what time space between visit 1 and 2, and what are the procedures. So this is a snapshot of the protocol visit schedule. So you can see the visits and then each of the assessments, and the cross means that assessment needs to be done at that visit. That's what the cross means. And then you have the timeline, D1, D8, D15, that means day 8, day 15. Cycle means which is repeating every 28 days. So first we go to the first section, which is screening. So this is a very nice picture. These two fishermen, they are like two principal investigators. But do you think they got consent from the fish? I dare not. I don't think so. So for a clinical trial, it is like fishing, but with one exception. You need to get informed consent, because screening has a set of assessments to be done, and that's part of the trial protocol, and you need to get permission from the patient. So this is a snapshot of the timeline. So screening is done at minus day 20. So it means 20 days before randomization. It could be 20 or less, right? So let's imagine this patient did the screening, we say January, 2019, January 7th. And then randomization will occur 20 days later. So what are the procedures to be done as screening? So first of all, you need to get informed consent, just like consenting the fish, but we have to be serious here. These are cancer patients. So you need to get permission from the patient to do screening. And then you can look at the protocol for the explanation of each of these things. So informed consent, randomization, demographics, medical surgical history, diagnosis and cancer history, and so forth. So next one is demographics. So demographics means the patient's gender, ethnicity, and so forth. So we need to collect that. And medical and surgical history, because we need to know what medical conditions the patient had before participation in the trial. That is required for data analysis, and surgical history as well. Diagnosis and cancer history. So as you know, this is a lung cancer trial, right? So you need to know when was the lung cancer diagnosed and what is the history behind it. Is it 1 year before, 2 years before, and so forth. And prior cancer therapy. So one requirement for this trial protocol is that they had prior anti-cancer medication, but then the therapy failed, right? So you need to know that cancer therapy history. And then vital signs, that means blood pressure, respiratory rate, temperature, and so forth. ECOG performance, that means the cancer patient's functionality. This is a standardized score designed by a university in the US, I think. So ECOG, you don't need to know the specifics. So hematology, that means the blood function. How many red blood cells are there, white blood cells are there, platelets are there, and so forth, right? So that means blood function, because we need to know how much the body is functioning at this moment, right? Then chemistry of blood chemistry, that means electrolyte, sodium concentration, potassium concentration, ALT, AST, those are the markers of liver damage, and creatinine, and all those chemicals in the blood. That's blood chemistry. Urinalysis, you will be checking the urine for glucose and other things, right? And insulin, that's to check the diabetic status of the patient. The testosterone level only for male patients, obviously, and prothrombin time and thromboplastin time, that is a marker of blood coagulation. So you can look at each of these the assessments in detail in the protocol. So here you go. You can scroll through and read more deeply about the procedure. So the coordinator will also be looking into these detailed procedures and planning out before the patient comes. So what are the next procedures? Electrocardiogram. That is to see whether the patient has any cardiac arrhythmia, so had any heart attacks. So we do this as screening, so later on when you give the drug, you can see whether it had an effect on the heart, right? Then pregnancy test, obviously for female patients. So as when you're participating in a clinical trial, you're not supposed to be pregnant, because we don't know what drug effect the drug will have on the unborn fetus. So again, you can scroll through the detailed procedures in the protocol. So electrocardiogram is explained there. Electrocardiogram is done with 12 lead. It's a 12 lead ECG, and so forth. And then what are the other things? Disease assessment using a computer-aided tomography or MRI scan. So this is lung cancer, right? So you take the scan of the lung at the screening, and then also you do a brain MRI, because in most cases non-small cell lung cancer can metastasize to the brain. So you do a brain MRI to see whether there's metastasis in the brain. Tissue for molecular genetics. So you take a tissue biopsy of the lung cancer and do molecular genetics as well. Then you do plasma sample for exploratory biomarker analysis. That means you take the blood and separate the plasma, and you check for biomarker analysis, biomarkers of the cancer. Then then what is it? Patient reported outcomes assessment. Currently, most of the clinical trials or in a medication, we look at what is the effect on the patient. So for that, you need to do patient reported questionnaires to see whether how their life is affected and so forth. So those are the series of assessments for screening, and then using this information, you will see whether the patient matches the inclusion criteria and patient doesn't have the exclusion criteria. For example, one exclusion criteria is being pregnant, right? So if we did the pregnancy test and it comes positive, that means the patient doesn't participate in the trial, right? Or if there's severe organ dysfunction, evaluated organ or blood dysfunction, which we evaluated using the hematology, then the patient will be excluded as well. So that is what screening is. So like a very good fisherman, the PI obtained consent from the patients, and they did a series of tests to see whether the patient was eligible for the study. So this was done 20 days before randomization as stipulated in the protocol schedule. So that's the end of the screening protocol schedule part. And next one, we will look at randomization and drug assignment. So that's where you start, right? After ascertaining that the patient is eligible, that's where you start. So look forward to seeing you in the next lecture. Ciao.